I'm feeling very punctual right now. I don't know why, probably because I've been up so long today. I feel like I just want to get this started. I'm really excited about this. Let me tell you who I have with me here. My two favorite nurse practitioners. I've got Brittany Brown and Dominique. She's here. They both have wonderful experience, and they're going to talk a little bit about their experience as well. So we'll just kind of start. Brittany, how long have you been working with pellets or hormone? You're a women's health nurse practitioner, actually.
Yep.
Let me explain what that is. That's a specialty. So Dominique's a family nurse practitioner, which is kind of the broadest because you have adult and you have children's. Yeah. So you can do anyone. I myself am an adult because I focus on older generation, anyone over 13. So I'm an adult nurse practitioner. And then Brittany is a women's health nurse practitioner. So her specialty was in women's health. And you've been working in women's health for, gosh, probably 10 years, right?
Yeah.
As far as like a broad perspective.
Yes.
And doing hormone replacement therapy for like 6 or so. Yeah,
that's correct.
Yeah. And you've been working with pellets.
Yes.
And you also do some creams and stuff like that.
Yes,
So
a variety of different replacement.
okay, good. So very experienced. And then Dominique has about 3 years experience.
3 years
in hormone replacement therapy.
in pellets
specifically.
Yes.
Yeah. And that's what we're going to be doing here. So that's really most relevant is that we're going to be doing the pellets here, and we'll tell you all why. My personal experience is the least. So I don't know why I'm sitting in the middle. I think I'm just kind of the facilitator here. My experience is limited to my training. When I was doing my nurse practitioner, I had the wonderful privilege of training with Dr. Rodriguez. And a lot of you may know her. She's local and you've worked with her as well. And in collaboration, she's a wonderful gynecologist. And I was able to study under her, and I became fascinated with hormone replacement therapy when I did my rotation with her because of the personal testimony of the women that were coming through who could literally feel when it was time to get it replaced. It's just so crazy how much it impacts their lives that they would say, I know it's time, and would be confirmed by labs, but it was just interesting that the patient perception kind of was the first thing that they saw. And so I decided at that point to get pellets because I was starting to get hot flashes and like tons of anxiety from school and all that stuff. And she's like, I think we should check your labs. And so sure enough, it was a good thing for me. So it's been a couple of years now that I have had the pellets. And honestly, my number one thing that I see when it is time to get them renewed is clarity. My mental clarity is so much better when they're actively in my body. And when they leave, then I just kind of, the words don't come as quickly. And
brain fog.
Yeah, brain fog. That's the best way to describe it. And you guys know I do a lot of public speaking. So I really kind of need to be on my toes thinking all the time. And so I need that mental clarity. So I am the one knocking on the door, like, it's time, it's time. So that's kind of my experience limited. And then just what we've learned here since we've been doing it for a couple of months now. So that I'm the one that's the least experienced here. So I will defer to these guys as we go through with questions. I'll just be facilitating. So let me see. We have a question coming through. We'll definitely get to that as far as when you're going to feel results. And we'll just kind of start going through. So hopefully you guys can see my screen, and you can also see if you kind of minimize the speaker view, or I guess it would be the screen view you want to be on. And that way you can see us and the screen at the same time. But feel free to put questions in the box if you have questions. All right, so this is, we're using Pellecome, which is a company. There's really, as far as I am aware, only 2 companies that do the pellets, or there are more than 2. And there's just 2 top ones.
I think there's 2 top ones.
Okay.
But there's more companies.
It's kind of like toxins, right? There's 2 leaders that we carry, and there's all these little other ones. And so we kind of want to stick with the main leaders on this. So Pellecome is what we're using. And let's see if I can get to the next screen. All right, so you're going to watch a video next. It's about 1.5 minutes. It's just going to go over some basics about hormone replacement therapy. And as a voiceover, we had one of our current patients give a testimony about how his pellets really affected his life. And so you'll hear that as a voiceover. So I'll just let you watch that for the next 1.5 minutes. All right, I think I need a... There we go.
Hi, I'm a male, I'm 50 years old, recently had the testosterone pellets. Basically, I was feeling pretty fatigued, pretty tired, having trouble remembering things, and have a lot of injuries right now. Thought it might help with recovery. There's definitely a noticeable change with like the word I would use would be clarity, remembering things. For example, things that I would normally walk by and say, maybe I'll get to it later, I'll immediately do. Definitely changed my amount of energy. I don't have any problems during the day. Normally, I would just be itching for a nap. Now I don't have that urge anymore. I didn't experience any pain during the procedure. Everything went pretty flawless. And the process here at the Injectability Clinic is definitely more unique than going to your average HMO doctor or somebody that is kind of trying to push you out. I never had that feeling at all. I had gone in, I had met with the nurse practitioner. She explained to me basically what my benefits could be, the procedure from A to Z, conducted blood tests to make sure that I was a good candidate for it, which definitely showed that it would be beneficial to me. Every step of the way was perfectly explained to me. I really didn't have any questions. The questions were already answered during the explanation portion prior to the procedure.
Yeah, so I love that. I didn't want to make him go on camera, but I was like, if we can just record your voice, we can use it in. But you know what I'm hearing from him is like that what he was struggling with was procrastination, like putting things off, and very fatigued during the day, kind of wanting to nap. And I'm not labeling anyone, but sometimes those are symptoms of like a little bit of a depression too, right? Like, oh,
Sure.
I'll do that tomorrow. I'll do that tomorrow. Just sort of putting things off and just super, super tired. And so does this seem to kind of help a little bit with mood elevation?
Oh yeah, you're more motivated. You have the energy to be motivated. It's funny that he mentioned, going to a traditional HMO doctor. It was such a different experience because they would be very quick to start him on an antidepressant.
You're right. You're absolutely
That's a
right.
good
I'm glad
point.
you brought that
Yeah.
up because that's
Yeah.
like big pharma. Like, okay,
Exactly.
you're not
It's a
motivated. Oh, you're
quick
sleeping during
fix.
the day. You must have depression. Let me give you something.
Yeah.
When
Actually-
really it was just this.
Yeah.
Yeah.
And they actually wean you off. Like if you start hormone replacement therapy, there is a chance that you can wean off your antidepressants.
Mm.
So, I mean, there's a whole protocol to follow for weaning off purposes, but it definitely is a mood elevator.
Yeah, that's really an interesting concept. Not that we're saying it's not good to be on antidepressants, but sometimes that's not the
Always
cause.
the answer.
Yeah.
Right.
Yeah, that's great. I love that. That was great perspective there. All right, let's go to the next slide here. So just to give you some basics here, the B in BHRT, which is bioidentical hormone replacement therapy. The B is kind of the key here. It's bioidentical. So these compounds are actually exactly the same chemical and molecular structure as the hormones in the body. What do you guys have to say about that? Like, how does the body symbiotically recognize this?
Okay. Yeah,
Does it
it's a good question. So,
Mhm.
I always like to make sure too that patients know that identical hormones they represent or look like your own and mimic your own natural hormones. So and we'll get into like there's theories that is actually better for you. Yeah.
They're metabolized the same way. They're recognized by the different enzymes in your body the same way. There's that component of being like foreign is not there.
Great. Yeah, which
It's good to know that bioidentical is different from natural. So people always come in too and
Good point.
say, hey, are these natural? A lot of the hormones are made from like yams, like natural components, but they're still pressed, they're still manufactured. So natural versus like bioidentical, you have to be, they still are manufactured, but they act like your own natural hormones, so your body responds to them better.
and it's as far as from a patient's perspective, it feels like it doesn't feel synthetic. It feels like this is
Correct.
me. It actually feels like the old you, which is kind of the same thing we do with the face. Like we're not trying to change you and give you more testosterone or more estrogen than you've ever had. We're just trying to level set it. And it's kind of the same with our injectables. We're not trying to augment you or make you look different. We just want you to feel as good or look as good as you feel. And I actually wanted to bring that up anyway. It's just, how does this tie into an aesthetic practice? I mean, number one, we have about 95% women, and that is the number one kind of supporter of hormone replacement therapy. Although strangely, since we began a couple of months ago, we've had mostly men for hormone replacement therapy. So this is great. I love it. That's a good problem to have. But so our patient base is mostly female, but also they're also in the same demographic or age bracket that this would actually start to affect them. But the other thing is when you lose estrogen, your skin, it affects your skin. It thins out the skin. And your increased weight too. So we do some body sculpting. So it really does correlate so well. And then of course, our relationship with you guys, I've been in business, almost 14 years now. I've been doing this for 22. I've known a lot of you guys for 22 years. So we are close. We're very close. And it's a time where we talk about things in the room, and you guys do with your patients too. We have that time and that intimacy with our patients. And if they're just not feeling well, we explore that. And if it means hormone replacement therapy, we've been referring out to it a lot, even before we started doing it, because it is so correlated. And then when Brittany joined the team and she had such a great background, it was like, we've got to do this here. So, and it was wonderful that Dominique did as well. So let's go to the next slide. And there we go. So let's talk about prescription hormones, compounded versus FDA approved. And how does that management work, and how many people are actually using it? This is a Rose study. It showed that 2.5 million US women over 40 are using compounded hormone therapy. And compound therapy, what does that look like for those of us who aren't in this world? What do you think? What do we normally use for compound therapy? Some options. Or like compounded, like the patches and the creams. And
compounded is going to give you less side effects. It's less synthetic. It's basically tailor-made to be metabolized in your body the way that it's supposed to. The potency is there. You're going to have less highs and lows.
With the pellets, because they're in there all the time.
Exactly.
The patches and the creams, which are also compounded, we're going to get into this a little bit, but a little less compliant, and they're not quite as consistent as the pellets that have that slow release. So we'll talk about that a little bit more. But I think a lot of people have heard of or have tried like the patches and the creams, because that does tend to happen through your HMO or your primary care doctor or your GYN doctor. And so sometimes they aren't as effective because they're not as compliant. They're not as consistent.
right.
So you've experienced both, right? The creams and the.
Yes. And honestly, usually if I get a patient that wants to start on a patches or creams, or maybe that's that, it depends on the patient. And, I'll start them on a patch or a cream. And so sometimes they'll come back, and a lot of times they'll come back and say, I want to feel better. Like I kind of want more. And then we transition them to pellets. So there's nothing, it's nice to know that there are different levels. You can, but to answer the question too, regarding compounds, a compound pharmacy is a specialized pharmacy that creates and makes these drugs. And the reason the FDA doesn't approve these compounds is all the medications or ingredients used to make the compound are typically FDA approved. So I think that's one thing to, it's not just some random thing that's being thrown in a bottle. Each component is FDA approved, or typically FDA approved. It's just like
now that it's
put in that container and by a compound pharmacy, that is the issue, which you should that should like bring on some confidence.
Make you feel a little more comfortable.
Yes.
Yeah, for sure. Okay, great. All right. So we have this word pellet, which I was talking to a patient today, and I gave her the link. So I'm not sure if she's on it, but she's like, you got to change the name. I'm like, I didn't make the name. She's like, the branding is terrible. It reminds me of a rabbit food. I'm like, well, it kind of actually looks like that. Funny enough.
It actually does.
So yeah, there's a picture of it in the hand there, on a leaf, which is random, but, I didn't make the slide deck. But it does look like that. It's like a little tic tac or a grain of rice.
Yes.
It's very small, but they call it a pellet. That's the name for it. It's implanted, and typically we're going to talk about how to put that in, but we actually just make a tiny little incision and put it into usually the hip or the flanks. And inside these pellets, we have a combination of things. So I would actually love for you to talk about the combination, because in my experience, most often the progesterone is oral,
Mhm.
and then the estradiol and the testosterone are in the pellet. But it's saying here the pellet contains. So can you put it in there, or is it mostly just
Not-
taken orally?
Just taken orally.
Okay.
Yeah.
So that must have just been
I
a
mean,
combination.
that would be nice, because then you wouldn't have to remember to take your
Take your pills,
progesterone.
yeah.
But you have, if you have a uterus, you have to take
Yeah.
your
Yeah.
I can't even talk.
Progesterone. But
Progesterone
I'm
at night,
actually
yeah.
really glad we're touching on this, because I can't tell you how many patients that we've had in the room not on that, but on pellet therapy.
I know,
And we're like,
yes.
wait a
Wow,
second.
yeah.
Because I knew that clearly from
Mhm.
my training, that was like an absolute must.
Mhm.
So if you are on any sort of hormone replacement therapy and you have a uterus, you must be on progesterone.
Yes.
And we will get to the male. Don't worry, this isn't all about females, but this is kind of where it starts. And so it's inserted under the skin, and then as the potency diminishes, usually about 4 months is how long it lasts. And you might start, this is one of the questions already, the onset of action could be anywhere from 48 hours up to 2 weeks after the pellets are implanted. And they come in a sterile vial, and it says here a tic tac or a half a grain of rice. And so they're put into this little kind of feeder thing, and then just implanted in there,
Mhm.
and then they're slow release. So it's kind of like an extended release drug that is implanted. We actually have a guest, you guys. Billy just walked in, and I know, sorry, I told you if you come in, I'm going to call you up here. I just wanted to get your testimony for a quick sec. So pop over, Billy, because this is a great time, because Billy has been on pellets for a couple of years also. And she can tell when it's time to get it replaced. So we have here that it usually lasts about 4 months. And just from a patient's perspective, what do you think? You can maybe take my seat for a sec. That's okay. What do you think you feel when it's time to get your pellets? And how did you feel? How did you even know it was time to get some replacement? Or you had worked with some creams and stuff before?
I tried that. I wasn't a fan of the creams. You either forget to do it.
Mhm.
It's messy.
Yeah.
It just wasn't for me. And then I'm not a candidate for certain types of oral hormones.
Mhm.
So pellets it was.
Yeah. And when you got your pellets, what was the first thing you started feeling like about 2 or 3 days later?
More clarity, less brain fog. Excuse me, sleeping better,
Mhm.
sleeping a lot better,
Yeah. And that's
and
key.
more energy.
Yeah.
Mhm.
Right.
And then my
so-
skin started to get better. Just everything.
Yeah. And then as it's kind of wearing off, what are some things that you're seeing as it starts to wear off?
Well, I'm here right now. I'm getting my pellets in a couple of days.
Yeah, so you're
So
due.
I'm due. I'm starting to notice that I'm not sleeping as well. A little less clarity, little brain fog. I'm ready.
Mhm, mhm.
Yeah.
And what do we talk about mostly in the room with our patients? What are some things that come up symptoms wise that we think, oh, you might be a good candidate?
Oh yeah. I mean, no energy,
Mhm.
not sleeping well. Their skin is very dry and itchy. Their
Mhm.
hair is lax. They don't have a lot of volume in their hair. Just tired all the time. And then there are other things too. Low libido,
Mhm. Cranky.
cranky,
Yeah.
irritable,
Yeah.
things like that.
So the husbands like it just as much as the wives, to be honest.
They do.
When
Yeah.
their wives are feeling good. You know,
Yeah.
it's like,
In all aspects.
yeah.
They
Yeah.
like that their wives aren't as irritable,
Yeah. Mhm.
a little more calm, sleeping better, stuff
Yeah.
like that.
Yeah. All right. Well,
Yeah,
thank you
don't let hormones get a bad rap. It's not just a sexual dysfunction
No,
type
not.
thing.
Yeah.
So much more than
As
that.
we
much more.
age, we start to lack.
Yeah.
Not
Yeah.
that I'm old.
No, not at all. Not at all. Thank you for coming in as our
Thank you,
guest
Billy.
speaker. I think the more people who have had firsthand experience, the more that's going to speak to you guys, because that's what we find in the room when we talk to people, I think is pretty convincing when both of us are like, oh my gosh, yes, at 3 or 4 months, I'm like, so when can I get in? So,
Yeah, it's true.
yeah. So I think we've covered this slide pretty well. And then I think I actually talked a lot about this too, the subcutaneous delivery, that consistent release. And Billy had mentioned sometimes with the creams and stuff, you've got a time frame where it works and then it doesn't
And
work
just
and then you got to reapply and then like you forget and you get in bed and you're like, oh my gosh, I forgot to put, all right, forget it, I'll do it tomorrow. So the compliance issue is not quite as great with the creams. I know I tried the creams years ago, actually, just for like the skin aspect. And I was putting it on my inner thigh and I grew like a patch of hair. So like this is fun. So yeah, so some people put it on their arm and have seen hair growth there because of the testosterone.
Oh my gosh.
So I was like, oh, I don't think I need this that much. I'm done with this. So I haven't experienced that with the pellets, thank goodness. So there's that. And it's very effective. And of course the duration is about the same time as your Botox, coincidentally. I don't think they planned that, but that is actually pretty nice. So let's go ahead and have Dominique, let's have you take over some of the advantages of the pellets as far as like the delivery goes.
So the reason why pellets are just a better modality of absorption is because they are injected into the subcutaneous tissue. So that means fat tissue. We do place them on the lower hip, so kind of above the buttock. If you are lacking tissue there, then we could also put it on the lower flank. If you have some love handles, that actually works out really well for this. And we kind of create a little depot. So the pellets are released by cardiac output. So the more that your body is feeling like it needs it, it starts to get dispensed. So there's no highs and lows. You have a very consistent serum level. With the patches, with the orals, with the injections, you're going to have a lot of side effects because things are going to get absorbed. You're going to feel great. And then it's going to kind of drop off and stop working. So you have a little bit of an EKG duration thing going
what kind
on.
of side effects would they see more so with that, do you think?
You're going to feel great one day and then you're going to feel really tired and then you're going to get mood swings and then you're going to feel like nothing changed. And the efficacy is just not as long. You can burn through it pretty quickly. And most people do, especially if they become more dependent on it. So that's the beauty of the pellets is people don't really seem to have that issue. And they do feel it at the 3 and 4 month mark, especially if you have like a very active athlete, like a runner. They're probably going to need to come in just a slight bit sooner because they're going to burn through it.
Yeah, it's marathon runners and cigarette smokers because of the nicotine.
Okay.
Because
total opposites. But
yes, it's because it works via like cardiac output. So nicotine will increase the heart rate, and then marathon runners and things like that. So yeah, they will need to be pelleted a little bit more frequently.
Okay. That's good to know. I didn't realize that.
Yeah.
Okay, good. So a simple procedure, we're going to go over that a little bit more too. The other, I guess, thing to know is sometimes the creams are covered by insurance.
They are.
And the patches are covered by insurance. So that's a big differentiator, but hopefully you'll see kind of the advantages of the pellets over that. But what is your experience with like insurance coverage for these things?
I mean, if it's a compound, I have not seen. And maybe I
got it.
incorrect.
Okay,
If it's compounded, it won't typically be covered.
Tell me the ones that they will cover are not compounded. We already talked about how the advantages are for compound.
Yeah. So there's gels, estrogen gels and creams that are FDA approved or not compounded.
Okay.
There's the transdermal patches, the oral.
They're not bioidentical though.
They're not bioidentical.
Yeah. So they feel a little bit different.
Yeah.
It kind of feels like you're not on something, but it's not as symbiotic with your body.
Right. Exactly.
And we don't take insurance. So if you want to get them done here, you would not be able to do anything through insurance. Let's see. Okay, so we have a great question that came in. Once you start, are you going to have to take it indefinitely? So I'm going to let you take that, Brittany. What has been since you've had the longest experience?
So once you start,
let's go with a female first.
Okay. once you start the pellets, say for whatever reason you want to stop them, that's totally fine. You can come off the replacement, the hormone replacement. One thing you have to know is that where your body started, as in like that hormone deficit, your body will go back to where your baseline, or your original baseline
So
was.
it's not going to get worse, but it will
No.
go back to where it was, which was, you weren't feeling great, or you wouldn't have even inquired that.
Mhm.
So you'll begin to not feel great again, just like you did
Exactly.
beforehand.
Yeah.
But it doesn't mess with anything long-term as far as
No.
like,
No,
that.
no, unless you were, what you would never do, but unless you were like a 16, 15-year-old kid who was doing hormone replacement therapy,
Oh,
which
right,
you would
right.
not do, but
Yeah.
that would
Unless you're
mess you
going
up.
through a gender reassignment.
Yes,
Right,
there
which you
go.
might do it
Yeah,
at that point.
that's true.
But, and the same thing for males then. So there's, once you start, if you're like, this isn't for me, I didn't see a big difference, you could just
Same
stop.
thing. Yeah.
Okay, good to know. Good question. I wanted you to talk about the history of pellets, and I actually wanted you to cover too, the study that came out, I think it was 1973 or 75,
Mhm.
that I even heard of in nursing school before even doing my women's health rotation. And I know my mom had heard of it when she was thinking about doing this years ago. So it's definitely something that's out there in discussion. So let's talk about the history of it, and maybe what people have heard about hormone replacement therapy and like breast cancers and that kind of stuff.
Yeah. So, actually, this is a really good thing to point out. It was the Women's Health Initiative study, and it's a widely recognized study, but it's also widely recognized as flawed.
Where it's false.
Yes.
Yeah.
So what they basically did is they wanted to study the effects of estrogen on women. So they had all these women who are now postmenopause, who had no hormone in their body for 10 years. So they're completely dried up of their hormones. And then they just, pumped them full of, I was actually higher dose estrogen
Than you would ever get like in real life.
Yes.
Mhm.
And there was definitely a lot of side effects,
Mhm.
but it was done incorrectly. You would never do it the way that the study performed, and you wouldn't do it on this particular age group.
Yeah. So they were postmenopausal, which typically pellets are done peri or pre, or mostly
Yeah,
kind of
or
mid
like
to
right in,
late.
like, yeah, and right in
at the
menopause.
start of
It's
Mhm.
better to start them earlier
Mhm.
than start them later. So
Mhm.
you would say if you were ever having symptoms of hot flashes, night sweats, fatigue, decreased libido, there's no harm in coming and getting your labs done and seeing where you are hormonally,
Mhm.
and seeing if you need it.
Mhm. Mhm.
So
Yeah. And I think it just kind of it gave hormone replacement therapy a bad rap.
Yeah.
And then, with the surge of breast cancer, which is
Mhm.
probably more due to like hormones in foods,
Food, right?
right? So everybody, there's this increase, and now they're seeing it's probably more like the ones we're eating. Everyone kind of thought that this could potentially increase your risk for breast cancer, but that hasn't actually been proven at all. And then we're going to talk about some of the cardiac benefits as well. What about testosterone with males? I'm seeing here on the slide, it was kind of in the mid 40s for being manufactured. What has been kind of the history on male replacement for that?
for the pellets in general.
Mhm. Or just like male hormone replacement therapy. When did they start treating andropause?
Yeah, so I believe they, like, as far as in the medical field, started treating andropause as a condition was probably in the 1940s.
Okay.
And yeah, and like men are definitely a candidate for this. It
Mhm.
would be testosterone only.
Mhm.
And andropause can start as early as, well, 40s for men. And that's again decreased libido. Usually men come in because of sexual dysfunction, but decreased libido and strength, they're like, sign me up for some testosterone.
Yeah. It's a lot of people who are active and lifting weights and kind of active out there are noticing like a decrease in just even vigor or whatever when they're working out or when
Right.
they're doing their
Their stamina.
activities. Thank you.
Mhm.
That's a good word. Yeah, their stamina in all ways,
Right.
physical and sexual stamina. So this is good. So and it was great that medicine recognized that there was a need in that avenue as well, and that this should be something that we should be looking at. So you had mentioned earlier about the highs and lows with the patches and with some of the other things. So we have oral in the orange on this variability, and then we have patch in kind of the turquoise. Hopefully no one's colorblind. And then the purplish color is the implant. And you can see like that kind of level set. There's none of this high
Steady.
and low, no day-to-day variability. So that's one benefit, well, one of the many benefits to the pellets. All right, so let's talk about some things that we have seen evidence-based, which means research-based, and every single one of these side effects, which is what we're looking for, right, has a source. So when we talk about evidence-based, we're looking at peer-reviewed articles that are highly scrutinized. There's usually a slew of people looking at these articles and making sure that the studies are done correctly and all of that. And so this is great that we have a source here, but we're looking at increased energy, improved sleep, relief of migraine or menstrual headaches or cyclical headaches, relief from depression. We mentioned this earlier, decrease in anxiety, and an increase is for both male and female, increase in muscle mass and bone density. And as women, we lose so much bone as we age. So this is something that's kind of prophylactically sustaining that bone density. So that's a great thing too. Decrease in soft fatty tissue. Always a good thing, right? Increase in coordination and physical performance, and improved skin, increase in collagen and elastin, which of course we love.
Yes.
And that was actually one of the things that people do notice with the creams. Wherever they put the cream on, the estrogen cream, that skin tends to get a little bit more dense. And so we looked at and are getting possibly a compounded topical estrogen cream that we can use on the face.
Yes.
To kind of, just to thicken the skin, not necessarily for hormone replacement, but just to kind of thicken the skin.
It's a what do you call it? Localized treatment.
Yeah, transdermal effect to the face.
Very localized.
Yeah. And increase, this is my favorite, concentration and memory. Like that needs to be my superpower because I need that as much as I possibly can get. Concentration and memory for my life and just like everything functioning. I mean, that's key. And then overall physical health, blood pressure, lipids, glucose. Why don't you take that for us real quick? Just like, what does that do? How can it help increase your fats and sugars and your blood pressure?
Yeah, so it actually
Regulate.
helps with like metabolic syndrome, and it helps with cholesterol. It's actually kind of a cool point where when you go in and you have a consult for hormone replacement therapy, your provider should look at your labs, and right away, if you have elevated LDL, which is a bad cholesterol, or elevated triglycerides, which are a bad cholesterol, you would not be a candidate for oral estrogen. You cannot take that. That'll increase those things. So it's the point again where like the pellet, because it bypasses the liver, not only does it not increase those things, increase the bad cholesterol, it actually improves them. So,
So just a good point, because we did have a patient the other day that had a history of a stroke, and she was wondering if she would be a good candidate for hormone replacement therapy. Her doctor said no to the oral, but didn't mention anything about the pellets. So it's, I know you have to look at the labs, and I'm not holding you to it, but it is interesting that it's like kind of patient by patient, but also compound by synthetic and bioidentical, and how that could actually make a difference as well.
Yeah.
So that's really neat. And then of course we can't not talk about improved libido and sexual satisfaction, both male and female. These are sex hormones, right? And so not only are they feel good as far as depression and anxiety, but it is sort of the thing that increases that desire for the opposite, or whatever, not the opposite, I shouldn't say that, but the one that you're desiring
Your
to be
partner,
with, your
yeah.
partner. So, so that's a wonderful side effect. And that comes up a lot in conversation with our patients.
it's actually funny because it's one of the reasons, like I've pelleted mostly females, because the practice is female driven. However, the counterpart always comes in because they're like, oh my gosh, my husband or my wife or my
Right.
partner, libido is through the roof. I can't
Mhm.
keep up with him. And we're like,
Yeah.
okay, well,
So
now it's your
yeah.
turn.
You take me up to that level,
Yeah,
right?
yes.
Yeah, that's actually, yeah, really true. I think
Mhm.
the people that I know that are pelleted have really noticed that, and that tends to kind of drive in the partner as well,
Mhm.
just to kind of keep up with that. So, and then we already mentioned this, but no increased risk of stroke or blood clots with the bioidentical pellets. All right, I'm gonna close that out and just so I can see better. All right, so let's talk about androgen deficiency. So these are some things that can happen when you are deficient in testosterone for a woman, and we'll finish this and then run to the males. But so if any of these symptoms speak to you, feel free to give us a ring and make an appointment for a consult. But are you tired? Do you have mood swings? Pretty much a lot of people could resonate with these.
Mhm.
Tension, lack of sleep, Billy mentioned that too. And that's actually kind of a decrease in what is it, progesterone too, that kind of helps you sleep a little bit more?
Compounded
Compounded.
progesterone
Yeah.
helps with sleep. Yeah.
Yeah, that's a nice thing that you have to take that, and then you take it at night and it kind of helps you sleep better.
Mhm.
Memory loss, a decrease in sex drive or libido, depression, hot flashes, which is oftentimes that's like usually the first like known symptom that people will start talking about this
Yeah.
for, because they might have already been tired and had mood swings anyway. They don't really correlate it with this, but then they start getting these like weird electrical hot flashes,
Mhm.
and they're like, I think I have like hormone imbalance, although some of these other things were already there. The night sweats, weight gain, joint pain, which I found kind of interesting. And it'd
Yeah.
be hard to like correlate to that,
It's
but yeah.
estrogen actually helps lubricate a lot
Mm.
of things in our bodies. It, you know,
From vaginas to joints,
to your
right?
eyes.
To your eyes, to
Yes,
dry
right, even
eyes.
your eyes. So it's very interesting. So yes, joints, estrogen can lubricate the joints. You give yourself a little estrogen, it helps re-lubricate those joints. Also, testosterone decreases inflammation. So if you have inflamed joints, that it has there's a possibility that it can help reduce that inflammation in the joints.
Yeah, it's like,
Mhm.
sounds like a miracle drug to me. How about this? Does anyone have a fatigue crash at 3 to 4 p.m.? Okay,
Oh,
like
yes.
everybody, young moms, new moms, like who doesn't? But what is the cause of that actually? And then again, loss of libido, just no drive, no motivation there in that sense. So how bad are they? How many times a day do you get, or how many times an hour? We could start with that
Mhm.
sometimes with hot flashes. The sweating, is it life altering to you?
Mhm.
Do you have to change your sheets every night? I mean, these things, this is like quality of life, right?
Right.
An unusual awareness of heartbeat or heart skipping, heart racing. Is this something your patients talk about, or do they even correlate
Yes.
to this?
Yeah.
Yeah.
No, they
Some people
definitely
get palpitations,
Mhm.
unexplained reasons that are not cardiac related.
Mm-hmm.
Yeah.
Sleep problems. That's probably a top one that people
Oh,
come in
yeah,
and say,
100%.
like, I can't sleep. And for someone who loves sleep like me, 1 minute of sleep less, I'm like, I need something to help with this.
That's so
I love my
funny.
sleep. So yeah, but difficulty falling asleep or difficulty sleeping all the way the night through,
Mhm.
waking up early. And then we kind of already went over this, but depressive mood, just an overall feeling of like down, like maybe on the verge of tears, or just like the guy was saying in the video, just this lack of motivation in life,
Yeah.
and highs and lows and irritability, snapping at your family.
Mhm.
Yeah, sometimes
Those are
it's
some
it's
things.
the other person's partner who's like, you need to go get your hormones checked. You are
Yeah.
crazy.
Yeah. I kind of like, I don't know if I should say this on the live thing, but I kind of did say that to my mom. I was like, maybe you should go, like, years ago. I was
Do
like,
some labs.
yeah,
Yeah.
because when you have someone who's kind of like totally even killed their whole life, and then all of a sudden there's like
Yeah.
this spark, you're like, this isn't
It's
normal.
not normal for
Yeah.
this
Yeah,
person.
your person changes.
Yeah. And anxiety, of course, feeling of panic, mental exhaustion, physical exhaustion, impaired memory, decrease in concentration, forgetfulness, sexual problems, change in sexual desire. You mentioned the dryness, vaginal dryness.
Mhm.
That's a big one. Working in GYN, we heard that a lot. There's lots of things that we can do for that, but this
A
is
lot.
one of them that really
Yes.
helps, and it's nothing you have to do. It's already in there. difficulty urinating and bladder incontinence. This
Yes,
is
so
helpful for that
that is
too.
an interesting one. I've actually, it was, that's an interesting one. So it is, you wouldn't say, oh, come in and get a hormone replacement, it'll fix your bladder
Right,
problems, right?
right.
It's like this kind of unknown reason why this
Hmm,
happens, but
hmm.
sometimes when you get testosterone
Mhm.
and estrogen, your urination improves. Where
Hmm.
you used to have some leakage, you may not have as much. So, yeah.
Something to do with like the pelvic floor, the strength of the
E-
pelvic
e-
floor.
Exactly.
Yeah.
So, yeah, that's an interesting one.
Okay, well, we'll take it, right?
It's a good
Right,
side effect.
moms?
Yeah, it's a great side
Take
effect.
it.
Yeah.
Exactly. And you already went over the pain in the joint, which I think is fascinating. I actually did not even know that. So, okay. So what about the cardiovascular disease? So the number one cause of death in women is heart disease. 1 in 7 are premenopausal and 1 in 3 for
Geez,
postmenopausal.
I like how that number jumps.
Yeah.
I know, right? So
Mhm.
can you take that, Brittany, and just let us know what,
Yeah. I mean, it's just kind of the same thing that we were talking about as far as the metabolic syndrome
Mhm.
and things, and cortisol increase after you no longer have your estrogen.
mhm.
You get that back into the body. It improves the cholesterol. It can improve the insulin levels, and it's just all part of lowering your cortisol
Okay.
hormone. Once you, it's so funny because menopause is a natural thing that happens in life, right? But still, when you lose a hormone, like, it's all checks and balances. When you lose one hormone, another hormone takes over, and unfortunately, and when you go through menopause, cortisol level increases, and it can have an effect on your cardiovascular
heart.
system.
Okay. All right. Well, if we haven't convinced you now, how about decreasing abdominal fat? Your heart, but
Yeah.
also where
Your
you store
belly.
your fat. So cortisol
It's the
definitely
same
is
thing, yeah.
abdominal. Okay, good. So we can decrease that cortisol, which is going to decrease the abdominal fat. And then what about bone density? This is also important that you can see with the implant. There's a bigger change in the percentage of bone density than even oral or patch, or of course the control. This is a great study, though. It was pretty well designed. And again, we do lose bone as we age too, and that's one of the factors. So,
And I love that it shows you the percentages on that slide with like
Sending
the
back.
pellet versus the patch versus the oral. The implanted pellet increases bone density more so than the patch or the oral estrogen. So if you do have osteopenia or osteoporosis, estrogen along with testosterone, I would still do testosterone
Definitely.
too, will increase your bone density.
Yeah. Great. Okay, let's flip it over to the males and for a little bit. This is just a check again, a checklist, I guess, for males to go through. Do you have a decrease in libido? That's kind of the number one thing they notice, especially since it's a new maybe onset. Maybe haven't had an issue before, but all of a sudden,
Right.
Finding they're not as interested in their partner, or any number of things. What are some things that you hear from your patients, your male patients?
Yeah, mostly my male patients come in because of decreased libido and erectile dysfunction and muscle strength decrease.
Okay.
That's why
Those are the three
those are
things,
the
the three
main
drivers.
things.
And this
Yeah.
is, those are some hallmarks of their life kind of going
Yeah.
through. And so it could be a big change.
Mhm.
It can affect the marriage. It can affect the relationship.
Your self-esteem.
Self-esteem. Yeah.
Yeah.
And a lot of men are embarrassed to talk about it,
Mhm.
right? I know lots of couples, the wife tells me, this is a problem, but he won't go to anyone.
Yeah.
He's embarrassed.
I think too, for men to know that like a lot of men go through this is like so
It's freeing, yeah.
yes.
Yeah.
It's not like rare to see someone come in with erectile dysfunction.
Right.
It's common.
It's a part of life.
Yeah.
And it's something that we see, and just to make you feel more comfortable, or maybe your partner, you're trying to encourage them to come in, it might be a little more comfortable in our office than like a urologist. Do you know what I mean? Like it's like a very calm feeling.
Yeah.
It's very private. There's not gonna be a bunch of other men in the waiting room where you're like, oh, they
What's he
also
here
have
for?
ED,
Yeah.
like, so I just feel like, because we do see men for Botox and stuff. So like there's a
Mhm.
crossover. So nobody would really know why you were in the waiting room if you were
You
here.
could be
Right.
getting your
Um,
Botox and then just say, hey,
yeah.
by the way.
Yeah,
And it
exactly.
could just happen very naturally.
Yeah.
Mhm.
And it's just like the gentleman said in the video, it's not rushed. It's very calm. Like we spend a lot of time with you and make you feel really comfortable. And so I just don't want you to be nervous that you're coming into a place with all women, because it's not. We have a lot of men patients. Lack of energy, and this might happen slowly, over time. You might have just kind of been an on the go person, and now you're just like, I need to sit down for a minute, and that might be new for you. And so if we can give you back that energy, that would be great. Decrease in strength or endurance, and we mentioned, working out, but also just like golf and things that you would normally do for pleasure, just kind of fun activities. You're like, I don't have kind of that same push that I had before. Losing height, I mean, that kind of is something that happens with age, but decreased testosterone is the cause. So if we can kind of stop that at an early point, you may not see that over time. Decrease of enjoyment in life. Are you sad and irritable? I love these questions. It's like a counseling session. Are your erections less strong? So it can actually, not only sometimes they can't get an erection, but they might not be as strong or firm as they were in the past. A recent deterioration of your ability to play sports. So that also goes with like that hand-eye coordination, mental clarity, all of those things. Are you falling asleep after dinner? It's a telltale sign, guys. And it just a recent deterioration in your work performance. All right. So some facts about testosterone deficiency in males. And I think we've kind of went over this, but you've got thinning hair, decreased bone density, sexual dysfunction, decrease in lean body mass, that muscle mass, increase in metabolic syndrome and insulin resistance. So maybe sometimes the first signs that we see on labs is like, triglycerides or hemoglobin A1C are starting to go up. So that is all part of that metabolic syndrome and insulin resistance. And if we can stop it before we have to get to a point where we're putting you on, glucophage or something, like this is great. This is a really great option. So
to go back to the laboratory part of it, your primary may order a testosterone level, your hormone levels to check, and they may seem normal because there are different normals in hormone replacement.
That's a really good
therapy versus what would be considered normal just as a regular panel. 500 is typically when it's normal, but it's typically when men start to feel these symptoms, and we want to get them up to the optimal level, which is in the 900s, 1100.
So normal versus optimal are two different things.
They're
very
It's a
different.
really good point, Dominique.
Yeah, it is a good point.
And it's kind of like the thyroid too. Like your
Yes.
basic GP's like, oh, I'll check your T3, but they're not checking like the whole panel.
Right.
So that might be fine, but other things. And so it's very similar. And
Very-
so the labs are very comprehensive, and you girls might find something in those labs that would be, off that this could help.
A lot of times the thyroid will be off in addition to the hormone imbalance. So we're super thorough in treating that. You may just need a desiccated thyroid supplement to alleviate some of those symptoms in addition to the testosterone.
Yeah.
But labs are very, very telling when you read them the right way.
When they're interpreted right.
Right.
Because someone could had an 800 testosterone for their whole life, and then all of a sudden, boom, they're at 500,
Exactly.
and they're like,
Even though it's normal.
it's normal,
it
but
puts
now
you
you
in that
feel
gap.
bad. You've just dropped your testosterone 300 points. It's not going to feel very good.
Yeah, that's a really
But
good
you're still
point.
in normal range. Yeah.
Which is actually a good call out to get your labs early, because maybe you don't have issues, but you want to get a good baseline lab. And so we can get those labs, hold on to them. And then like a year or two down the line, you can see how it has jumped and see if that difference, because if you never knew your testosterone was over 800 and now you're at 500, you might think, okay, I don't have a problem, but you didn't know you dropped 300 points.
Right. I got no
Exactly.
idea.
So
Yeah.
that's
So
a
having
good-
that baseline, that's
Yeah.
a really good point.
Yeah. So even if it's just for that, just get some labs on file so we can kind of watch over the next couple of years,
Yeah,
because I'm
exactly.
creeping up on this.
Yeah.
kind
That
of
would be an
thing.
interesting thing to actually do too. And
Yeah.
sometimes people feel really bad and you'll do their hormone panel and their hormones are optimal. They are
Mhm.
okay. But their vitamin D is in the 20s. Their
Mhm.
vitamin B is like 100,
Right,
which is super
right.
low. And fixing those two things,
Which
can
by the way, we
increase-
do here.
We do,
So that's
yes.
always good.
Yes.
Yeah.
And fixing those two components can
Can give 'em
increase.
back the vigor.
Yes,
Yeah.
yes. So not only if you run your labs can you find out that you're maybe not a candidate for hormone replacement,
Mhm.
but then you may be a candidate for some good supplementation or some good IV
IV
therapy.
therapy,
Yep.
yeah,
Mhm.
to help you.
Yeah.
And the cardio fit is a great alternative for that
Mhm.
too. So we have a question that came in as far as the labs. Can we order the labs or do we need to do that with someone else? So that's a great question. Thank you. We can do that here. So we've come up with some really thorough, great labs that we think are very diagnostic and we know how to interpret them. We meaning them. And we can do that. We can actually draw your labs here. So if you don't, we can give you an order for it and that's fine. Your insurance will cover them through LabCorp or Quest. We can give you the order. You can go there. But if you guys have been there lately, it's a mess.
It's a mess.
You'll be there hours and there'll be a lot of sick people around you. You can't make an appointment anymore. So it might benefit you just to pay our lab draw fee, which I believe is roughly $150 or something like that.
Yeah, I think it's even less, but
Yeah.
I think it's a little bit less.
Less than that, $100, 150, and to let us draw the labs, send it out to the lab and get it back, the report,
Yes.
and then have you back in for a consult. So that I think I would pay that all day long
Yeah.
to not go to that
Yeah, just
place.
for the convenience.
Yeah.
Yep.
Convenience. So that was a great question. So atherosclerosis increase in I'm covering my slide here. Oh, angina, so chest pain and some ischemia and various cardiovascular disease. So these are pretty scary
Yeah.
when you read it.
Mhm.
And it is brain protective. So the
Alzheimer's.
Alzheimer's disease, testosterone is brain protective.
Give me more.
I
When
know.
can you fit
So
me in?
even people are like, oh, I don't have symptoms,
Yeah.
but they're clearly in, above the age of 45 or a female who is in menopause. And they're like, but I haven't had any of these menopausal or andropause symptoms. But there's benefits in hormone replacement, even if you don't have symptoms, because there's benefits, there's wellness benefits.
Right. That's a really good point because you're right. They may not have those traditional symptoms, but they want to be preventative that way. Yeah. I want to prevent Alzheimer's, please. We talked about cholesterol and we talked about blood pressure and increased mortality. Obviously, all those things increase mortality. So, and here's another really cute schematic, right? Why do you need more testosterone? Because you want to look like Arnold Schwarzenegger on the right, not like Grandpa over there. Kidding. But decrease in muscle mass, you got man boobs over there, low libido, it's pointing right to the problem. Decrease in athletic performance, all of that great stuff. So low testosterone affects 40% of men aged 45 and older, and it's a high percentage, right? And we've even seen it even earlier. We had a man in today in their 40s that I thought might be a good candidate for this. So we talked about it a little bit. Rising rates of diabetes, obesity, COPD, chronic kidney disease, all of these things we're seeing higher rates for sure. So I think we got that covered. Okay, so let's talk about heart disease for males and females, but let's see, we've got here a statistic: 1 in every 4 male dies of a heart attack. That's
the same
super
as
high.
1 in every 3 postmenopausal, 1 every 4. Yes.
Any of these points you kind of want to talk about a little bit, or
I feel like it's the
we've
same,
covered it? Yeah.
thing is decreasing your bad cholesterol,
Exactly.
increasing your good cholesterol.
You have less LDL, you're going to have less chance of one of those guys hitting a plaque in the artery and causing a heart attack or a stroke or a clot. So that's physiologically why it is cardioprotective. Because naturally those things are going to go down, so your risk goes down.
Yeah. One thing that the slide deck didn't really cover is like prostate cancer? Is that something that you're looking at? Are you looking at
Oh, yes. So for,
PSA levels?
yes,
and-
that's all part of the labs. If you, this is, it's a great question because a lot of times, men will come in and their PSA is above 2. We wouldn't give you testosterone replacement if your PSA is above 2. Doesn't mean that you have prostate cancer.
Or you will, or you will
Yeah.
eventually
Nothing,
get
yes.
it. It's just,
Just now it's just go visit your
Yeah,
urologist,
exploratory.
get, or your primary care, get that stamp of approval, have your full on wellness or general check with them.
Mhm.
And then, but we check because if there was ever prostate cancer, testosterone can feed that.
Mhm.
And so we're just really careful and we watch that. And if we do the same thing for women, we
Mhm.
make sure that you have your transvaginal
exactly.
pelvic ultrasound. We make sure that you have your
Mammogram.
mammogram, and that's yearly. And if you don't have those things, you won't get pelleted.
Yeah.
It's just a
You'll be
safety.
denied
You will be
treatment.
denied.
We're
It's-
very firm on
yes,
this.
It's just safety for us. So,
Yeah.
yeah.
So let's talk about that. Let's bring that up really quick about the estrogen dependent breast cancer. So the truth is if you have breast cancer already and it's estrogen dependent, meaning it's fed by
Mhm.
estrogen and you get pelleted, yeah, that's going to increase, that's going to accelerate it. If you don't have an estrogen dependent breast cancer, this is not going to affect it.
No, but there's very few cases where somebody with breast cancer can be given estrogen. That doesn't mean breast cancer patients cannot get help for their hormone deficiencies. We have one, if it were me personally treating someone that was being treated for breast cancer, you have to be off treatment, cleared, and then I would call the oncologist and
Mhm.
speak with them. But sometimes you can give these persons testosterone with an anastrozole, which is and no estrogen, testosterone with an anastrozole. Or there's a lot of good, oh my gosh, now I'm going to forget. Hello Bonafide has a great natural supplement that can help hot flashes, night sweats, sleep disturbances. That just works.
Like soy free and estrogen.
Yeah,
free
there
and all
it's
that stuff. Yeah.
completely hormonal free. And
Mhm.
actually the North American Menopause Society backs this company, Hello Bonafide, for their supplements and giving this to breast cancer patients
so
because they
there are
don't act on
options.
hormones. Yeah.
Yeah. But I know that's one of the fears of people who get hormone replacement therapies. Oh my gosh, am I going to get breast cancer
Right.
now? So it can't give you breast cancer. It can feed breast cancer that is there,
Yeah.
that is estrogen dependent, but it can't actually give you breast cancer.
Right.
So that's a big misnomer for sure. All right. So the benefits of the testosterone pellet, back to the men, go back to that. Increase bone density and muscle mass. We kind of went over this a lot. Increase energy, increase or decrease in anxiety and depression, relieving pain and inflammation, restoring sleep pattern, increase libido, sexual performance. It lowers the incidence of breast cancer in males, which is an actual thing. Nobody really thinks about that, but this actually decreases the chances. Heart protective. We went over that, I think, at length, and brain protective, restored memory. So very low side effects for the males, increase in facial hair. Now, can this happen to women? Just curious.
Yes.
Yeah.
Okay. So
It
we
can.
need, that's another reason we don't want to be putting testosterone cream on our faces. But you can have a little bit of increase in facial hair. Usually it's more peach fuzz than anything. It's not going to be like you're not
The
going to grow a
coarse
beard.
stubble, no
No.
5 o'clock
Yeah.
shadow.
No.
Usually you feel so good.
Yeah.
You
just
don't
get over
Let's
it.
go get a dermaplane.
yeah, you don't care.
Yeah, but for men, you might see a little increase in facial hair, not usually a problem. Some mild acne. Think of like a teenage boy, right? You've got a lot of energy, a lot of testosterone, and you might have a few breakouts that you might not have had before.
Can we just start the ZO?
There you go. We have
Yes.
we have a
we
solution
got-
for
we have a
everything.
solution.
Exactly. But really great continuation rate. So 93% of people who start pellets continue with it. So that tells you that they love it and that it works great. Obviously great compliance because it's in there. There's nothing else you could do about it. And it's convenient. You come in one time, you don't have to mess with it. And men like convenience. let's face it, they
Yeah.
like to just come in, get it done. So in conclusion, I think we've covered a lot of these things, but our data is supporting testosterone therapy and that implantation is safe and extremely effective. This has been done for years,
Mhm.
almost over 5 decades,
Yeah.
actually. It's a simple in-office procedure. I'm going to show you a picture of the trochanter coming up here, the device that we use, and we know all of these effective symptoms that are causative factors. What's going on here? Oh, I thought I had the trochanter in there, or maybe it was popped up earlier.
In
think it was
one of
earlier
the
in the
beginning
beginning.
Ah,
slides.
way back when. Let's go back to that because I really wanted to show you guys what it looks like and kind of talk about it for a quick second. But any other questions while I'm trying to find this really quick about how the process works? So there's a little machine. Boy, where did that one go? It was like farther
It may have
back.
been in the video.
Oh, it was in the
There we go.
video.
You're right.
Okay. Well, then I won't be able to show it again without playing the video. But it's like a little, I don't even want to use the word gun, but it's
It's a
like a little
device.
device that just sort of goes in.
Should say.
You're laying on your side. There's pictures of it on our website and our
Oh, okay.
Instagram, where you're just kind of, you lay on your side and you numb them up topically with lidocaine and a little epinephrine, so there's no less bleeding, we'll
Mhm.
say. You might have a little bruising, but it's on your butt, for heaven's sakes.
Yeah.
Unless you're like a bikini model, no one's going to be seeing that. And the big question though that comes up a lot in the room is like, can this scar? So with the device that Pellecome makes, there's less scarring than some of the other devices.
Yeah, that is true. I've seen the insertion healing difference between the two.
But it is possible.
Never
It
say
is
never.
possible.
But
It
it
is
still can
possible.
happen.
Yeah.
You're cutting
Mhm.
the skin,
Tissue.
you know,
Mhm.
you can
It's a
definitely
tiny incision. Would you say about
pinky fingertip
yeah.
or pinky fingernail.
Yeah, less. So like half an inch
Yeah,
probably.
very, very small.
And no stitches or anything. We just use some steri strips.
strips.
And so the post care is just no submersion for, what do you say, like a week?
No stairs, like no exercise of that gluteal
Mhm.
muscle.
Okay.
Oh, that's a good point too, because
Incline, bicycling, nothing where you would possibly extrude the pellets.
Mhm.
just for 3 days for women, 1 week for men.
Okay.
So same with submerging in water.
Mhm.
You can shower. It's just getting in a hot tub, a pool, a bathtub.
Right.
Yeah.
It just puts you at increased risk for infection.
Yep. Yeah. And so that's kind of the post care, and then they take the little steri strips off and they're ready to
That's it.
go. And if you do feel, you might feel like a little just induration or a little bump there for a couple of weeks maybe, but then you forget all about it.
Right.
It's not really sore or anything. And that's kind of it for post care. It's pretty minimal. Someone had a question. Is it too late for someone 76 years old who's never been on hormone replacement therapy? We were actually
Yeah.
talking about that right before we
Yeah.
started.
Yeah, and
It's a great
it
question.
is a very, very, very good question. I think, you know, estrogen wise, I think that it probably wouldn't be the best idea, but still, if you did labs and someone wanted to be on a low dose testosterone, I think
Mhm.
that would be okay. But I would be very, very careful with an estrogen.
We have to say we're pretty conservative here.
Mhm.
So you're not going to get anything that you don't actually need. But that's a good option because most of the things, I feel like a lot of the stuff that would be beneficial come from the testosterone. So it's really nice that you can
Yeah.
actually have that and
Mhm.
not have the estrogen.
I've
So
done
that
plenty,
might help.
like plenty of women have received testosterone only, you know, and
Mhm.
makes them feel really,
Been good.
yeah,
Yeah.
really good.
So there's options. We can customize it,
Mhm.
tailor it to your needs too. And even like if you did have history of breast cancer, you could still
Yeah.
potentially just get the testosterone and the progesterone.
Yeah, with the probably no progesterone, but
Progesterone.
with the testosterone with an anastrozole. But
Mhm.
again, we would talk to the oncologist.
Right.
And I think it's just always nice for someone who has gone through a cancer diagnosis to know that they can come in and have a conversation and review
Mhm.
labs, and that there are options for you. Maybe it's not the pellets, maybe it's not a compounded hormonal cream, but like there are things out
Mhm.
there and we can point you in the right direction.
Mhm. And I love that you have history. So Brittany worked in oncology, gynecological oncology. So she has a lot of experience with this. So I love that. That's really great. Some of the other questions that came in through our Google sign in, when is the best time to start hormone replacement therapy? What do you
So,
think is ideal?
yeah. So funny that we were kind of like, we were talking about this before we hopped on, and we would say like average age is 50 to 55, but like when is the best time to start? When you start feeling symptoms. I mean, there's so many different things that can happen in someone's life. You can go through premature menopause. You can have surgically induced menopause. There's man might go through andropause, in their 30s, so as soon as you start feeling symptoms,
And now that you know the symptoms and you can
Yes.
correlate,
then come get
Just
your
come
labs
and get
done.
some labs.
yeah, it's kind of low entry level, like no pressure. Just get your labs,
Right.
figure out if, you
Yeah.
know, it tells a story. It really does.
Yeah.
If those symptoms are correlated with the decrease. Okay, so that was actually 2 questions on age, and then 3 questions on age. So then the other question was, we talked about that cancer risk and if you need to stay on it for the rest of your life. So we covered that. And then 3 questions on cost. So I'm going to let you talk about that because I have kind of not been so informed on the cost of this, but we do have a consultation fee.
Mhm.
And then we talked about the lab one, but then talk about the cost of the pellets or the
Um,
consultation fee. Just kind of talk about the cost.
Okay. So, and I always break it down like this because
Mhm.
it makes sense, because it is an expense, but you're putting this into yourself. And I feel like, so every 4 months, it's $400
Okay.
for a pellet insertion for women. Every
So $100
6,
a month.
yeah,
Mhm.
That's like
exactly. So
quality of
that's-
life.
yeah,
Like,
I think that's
we
what
paid more than
another
that
thing-
in like coffee.
Well, and if you get any compounded
Yeah.
cream, it's
about
gonna
that too.
cost you $100 a month.
Mhm, mhm.
So either way, if you're looking for a compounded
true.
medication, or treatment, it's
Same cost.
cost. So I
Except
think
this
that's,
is actually, it works.
and
Looks
you
better.
don't have to
Efficacy.
worry about, doing something daily or
Mhm.
when you
Right.
just come and get it inserted, you're done. So yes, and then there is a consultation fee. When you come in and we go over this extensive lab review and we kind of figure out what will best work for you.
About an hour visit.
Oh, easily.
At the
Yeah.
most. Yeah.
Mhm.
Well, at the least, I should
Yeah.
say.
at least.
Brittany is very thorough. So is Dominique. So we'll schedule you for probably an hour and a half going over the labs and
Yeah.
kind of figuring out what we need to do. Now, we might recommend supplements too. And it's not because we're like super supplement pushy, but it's very well known and studied that some of these hormones work better in conjunction
Mhm.
with supplements. I know my gynecologist put me on, like, I'm taking ADK and DIM, like I
Mhm.
take all of that stuff because why would you spend this kind of money on pellets and then have it not work its best optimal?
Exactly.
Yep.
And the
So-
men need to take the supplements
Yep.
if they're going to be pelleted, because testosterone can have a way of turning into estrogen should they not take those.
Mm. Ooh,
The
that's
DIM.
good.
The DIM,
Yeah.
it
Wow.
aromatizes. So
Okay,
it
that's
all works in
very
conjunction.
punitive. Good
Mhm.
job you went through that. But I find that men are actually very compliant. If they
Yeah.
are told something,
If they know they're
do,
going to
they'll-
get emotional, they're going to take their
if they know
pill.
we're
Yeah,
gonna
they're
get
gonna
man
take their
food,
Dims.
they're done. They're like, okay, I'll do
Yeah.
it. So any other questions, you guys? I think this has been really great. You've been
Yeah. That was
really
so nice
good
that
with the questions.
this person asked about their mom. That was
I
really
know.
sweet.
Yeah,
Mhm.
really nice. I think we recorded this. So if you guys want to send this to someone that you know or have want to watch it again because you were, I don't know, cooking dinner and maybe couldn't listen so thoroughly. Maybe you were asleep after dinner because you need
You had that 3 to
pellets.
4
Yeah.
o'clock crash.
We did record this, so we'll send that out. But I really appreciate you joining. I totally appreciate you guys coming
Yeah, of
on
course.
and
Thanks
like
for having us.
just
Thank
working
you
with
so
me.
much
They
for
were like,
having
"Can we prepare for this?" I'm like, "No, it's just gonna go the
know.
way it's gonna go, and it's gonna be organic." And it turned out great. So thank you so much for watching, and hopefully we'll see you in for a consult. It's not a big deal to come in
Yeah.
and start with labs and a consult.
Yeah, just talk to someone.
Yeah. All right. Have a good night, you guys.
Bye.
Night.